Hi guys, today we're going to do a jawline filler treatment. This patient is a little red. She just had Clear and Brilliant Permea for pigmentation on her face. But if you look at the jawline, the skin has already been prepped by me using HIPAA. We're going to be using Restylane Lyft, which is a high G prime filler, a sturdy filler from Galderma. And I'm going to be putting some filler into the chin, the pre-jowl hollow, so the anterior jawline here, and then the posterior jawline. So if you look at this patient, you can see that there's a give where you lose some of the mandible here and at the angle of the mandible. And then also in the pre-jowl, you've lost some volume. And then as you age, the chin kind of almost everts, and so we're going to kind of improve the projection of the chin and pull it back out. And that will increase jawline definition, a very common indication these days for filler, and one that I really like the results with and we're hearing a lot about. And so I'm happy that we're able to offer this to our patients, and now we have a video to show them the procedure. So now I've injected Restylane Lyft into the chin and in the pre-jowl hollow on this side, or the anterior jawline on this side of the face. And now I'm going to just use a cannula. That I did with a needle, and now I'm going to use a cannula to inject the posterior aspect of the jawline. I've marked out here where my finger is the antegonial notch where the facial artery comes up. And so we're going to avoid, that's deep, we're going to avoid, of course, injections deep in this area. So what I've done here is I put a little bit of volume in the chin, the pre-jowl, as well as the posterior jawline, and you can see much improved definition of the jawline, particularly the posterior jawline, as opposed to the other side where she has a decent amount of volume loss in a couple of compartments there. So what I like about the cannula is less bruising. Actually, in this case, along the jawline, I think the patients tolerate it better as well. And the safety, the facial artery is right here. I know it's deep, and so I'm staying in a plane above the facial artery. And so a needle can be used here even though the facial artery is there, as long as you know the depth of the artery. But the cannula just adds a little bit extra safety, in my opinion. Alright, so that's the treatment. I used 3 1 ml syringes of Restylane Lyft and HA filler. I put a little bit into the chin, a little bit into the pre-jowl or anterior jawline on both sides, and then into the posterior jawline as well. You can see that there's much improved definition of the jawline, as well as the shadowing underneath the jawline. You can see that on the other side as well. Pre-jowl, chin, posterior jawline, and the angle of the mandible right here is much better defined.